Hi, it's Lenora from the Wichita Falls Birth and Wellness Center. Just wanted to kind of show you what's in one of our birth suites. Some of the emergency equipment and things that we have on hand when you come to have your baby. Of course, one of the first things that we have is oxygen. So we have it readily available. We're prepared to do neonatal resuscitation or give your baby some oxygen if they need that. We have the ambu bag if the baby needs a little bit of help breathing. We also have one for the mom. If medication is needed or any emergency arises, readily available, we have emergency equipment. And we have a box for the mom, and I'll just kind of show you some of the things that we have in here. Of course, here is our ambu bag, or if mom needs some assistance with breathing. We can start an IV, so we have readily available IV fluids, catheters to start the IV. We have medications that might be needed in an emergency, all right here, easy for us to get to. Then we also have emergency box for the baby. Again, readily available. We try to keep them out of sight so as not to arouse worry, but it's all right here if we need it. Another ambu bag that's a breathing apparatus. We can start an IV on a baby. So we have IV fluids for the baby, suction equipment, even a little nasal cannula for a baby if they needed just a little bit of oxygen. We have a way to keep their airway open with a little airway apparatus. We also have a laryngeal mask airway. It's also called an LMA, but another way to help baby breathe if baby's having issues. Then we also have a transwarmer, and the transwarmer is basically a hot pack. It has the little activation button, and we just bend that, and then this becomes a heat source for the baby, because if we're having to start IVs or do some resuscitation to the baby needs to stay warm, and this is the best way to do that. Outside of an emergency, we also have the equipment that we would use just to monitor during labor. So we have a Doppler to listen to the baby. This Doppler can also work underwater, so if there's a water birth, we can keep track of the baby's heartbeat with the Doppler. And then of course we have the standard blood pressure cuff, stethoscope to listen to the baby. So another thing that I think is pretty important, sometimes when moms are having babies, they have a little tear in their perineum that needs to be fixed. And we can do that here as well. So we have a little kit that has suture. Of course, we have numbing medicine. Wouldn't want to be stitched up without a little numbing medicine. But everything we would need to repair a tear. So if you have any more questions about a birth center birth or what we keep in our birth suites, give us a call or check our website and we'll get you some more information.